This is Jefferson Close-Up, and I'm Carol Celine. My guest today is Dr. Christopher Skidmore. Welcome.
Thank you.
Now, you told me that you went to one of the largest high schools in the United States, up in Long Island, and that you graduated in the top 100 out of nearly 1,300 students. So that was way up there. But aside from academics, you were very interested in sports, soccer in particular, and the outdoors. So tell us a little bit about your activities.
Yeah, so I was very fortunate. I had the opportunity to play on a travel soccer team, and my soccer team actually had the pleasure of going to Germany twice. And each time was for 2 weeks, and we got to live with a German family and play local soccer teams. And then my other my father is an avid outdoorsman, and so I also grew up doing a lot of outdoor activities, including hunting and fishing.
And what else did you do in summers?
I would also work with my father. My father was a New York City fireman, but on the side he had a contracting business, and so I actually did construction growing up.
You had an interesting sort of job when you were in college.
I did. I've done several things in college. I was on the Student Government Association, and when you're elected to be one of the officers of that organization, you actually have to have office hours, and they actually pay your tuition.
But you didn't go into government, which obviously was an interest of yours. You chose medicine. Why is that?
Well, I like helping people. That's really why I got involved in student government, and both my parents are public servants, and they kind of pushed me in that direction to do something where I could actually give back to the community.
Let's talk a little bit about your work. You're a neurologist, and you specialize in epilepsy. And that's a frightening word for a lot of people. I mean, you get this vision of someone writhing around on the earth, but that's not really so accurate, is it?
No, it's not. I mean, that's one of the greatest misconceptions when you think about epilepsy. The overwhelming majority of individuals with epilepsy actually are living normal lives. They have to take medication, but they're relatively living normal lives. And that is a great misconception when people think about epilepsy.
What are the symptoms?
Symptoms can really be quite varied. It really depends on where the abnormal electricity in the brain that causes the seizure, where it's coming from. So it can be anything from a déjà vu sensation, a funny smell, to losing awareness and looking like you're daydreaming, to a full-blown convulsion, which is the falling on the ground and shaking all over.
Now, you mentioned something about the brain and electricity causing epilepsy. Could you explain that a little?
Sure. So the nerve cells in the brain communicate by sending electrical signals to each other. Epilepsy happens when one of the areas starts to have abnormal electrical activity. And if that abnormal electrical activity starts to spread over other areas of the brain, that's when it then disrupts the normal brain function, and then we see the symptoms of a seizure.
How did you select this specialty?
For me, it really marries everything I love about medicine. I love to talk to patients, and I love to interact with them. And epilepsy really is about 90% history. It's all about talking to the patient. But then I also love neuroimaging, and I get to look at a lot of brain scans, and also get to work in my field with epilepsy surgery. And so I actually get to work with the surgeons and do some work in the operating room as well.
Tell us a little bit about some of the technology you're using today to treat epilepsy.
Well, we have, Jefferson is a comprehensive epilepsy center, so we have all of the latest treatments for both medical as well as surgical therapy. On the surgical front, the newest things are these brain stimulators that we're researching. So instead of traditionally, if we identify the bad area, we would have the surgeon remove it. Now we're actually trying to look and see if we can actually stimulate the brain electrically to override the bad electricity.
And for people who can't be operated on, they're able to be controlled by medication?
So 2/3 of individuals are controlled on medication and do very, very well. 1/3 of individuals are not controlled on medication. That's where we then offer the other options, such as surgery and the stimulators. There's really only a handful of centers in the entire United States that's doing the volume of work that we're doing here at Jefferson.
Well, then you're in the right place for what you do.
Absolutely. It's why I moved here 6 years ago to work in this center here.
Well, thanks for coming in today.
Thank you very much.